welcome to my prenatal crash course. So I'm so excited about the opportunity to be able to share some of my information with you. So for those of you who don't know me, I am a maternity nurse. I've worked in postpartum, I've worked antepartum, NICU, pediatrics, a little bit of everything. And this course is just basically my way of trying to share these resources with other families, just because I think it's very important that moms know what to expect and that parents know how to take care of their children. So with this course, it's very comprehensive. We're going to talk about pregnancy, we're going to talk about labor and delivery, we're going to talk about mommy care, postpartum care, along with baby care. Important is to complete this series just because I really want you to get an in-depth knowledge of everything that we're talking about. And also, I'm very happy to note that I'm also a certified lactation counselor. So any questions that you have about our lessons or about any of the materials on the website, you can always contact me, and I would love to have a private consultation with you. I do have consultations over phone, over Skype, WhatsApp, basically anything that you want. I can work with you and can work with your budget as well. So please contact me if you have any questions about anything. For today's class, we're just going to learn about pregnancy. We're going to go in depth about what to expect in the different trimesters, what to expect about your baby's growth and development, when you will be seeing your physician, and just a few prenatal complications, just because I think it's very important to get a good understanding and grasp what's going on inside your body. So first off, in your first trimester, you usually will be starting to get morning sickness, you might have frequency of urination, you might have breast tenderness, and all of that is very, very normal. What helps is just make sure that before you go to sleep, try to pee. That way hopefully you won't have to pee as much throughout the night. Some people do have heartburn as well. Just make sure that if you have heartburn that you talk about it with your doctor. But the best thing you can do is avoid fatty foods, greasy foods, things like that. And once you start drinking more water, that will really help to kind of balance things out. Your second trimester, usually you start getting a little bit of a second wind where you're like, all right, I got this. You might get a little growing belly, you're starting to look pregnant and not just bloated or fat, so you kind of are like, all right, I can finally start wearing these maternity clothes. One thing that a lot of people do end up getting, and I had this with my second, was actually nasal congestion. I wasn't really expecting it, but if you do have nasal congestion, you can always talk about it with your doctor. Sometimes they recommend these sprays, but not Afrin sprays. They might recommend like a saline spray. Just make sure that you talk about it with your doctor. Sometimes in the second trimester, you might have a little bit of a backache, or even start getting sciatica, which is when you pretty much have like a stinging pain going through your sides or the inseams of your thighs. I had those as well. It's not very comfortable, but what you can do is you can get like a belly band, you can put it around you to kind of help support, and your back as well. That really helps. Sometimes people also have Braxton Hicks on their second trimester, which are pretty much like practice contractions. These usually are not anything to worry about, but of course if you have any vaginal bleeding, any abnormal discharge, especially if it's accompanied by a foul odor, you definitely want to talk to your doctor about that. And then of course the third trimester is the last trimester. You're like, I just want to get this baby out already. Especially as your baby starts moving up, it gets a little bit harder to breathe. Your diaphragm has less space to be moving up and down, and all your organs kind of get pushed to the side. So you're going to be peeing more often as well. You're going to be having a little bit harder time breathing sometimes, but just make sure to have active breathings that you're thinking about. Sometimes if you're having a hard time breathing, what you can do is just breathe in, breathe out, kind of regain your oxygen supply, and then move on from there, and that really helps. And then again, for peeing, just make sure to try to pee before you go to sleep, even if you don't feel like you need to. Sometimes it helps just to pee before you head to the bathroom. Well, pee before you head to go to sleep. That way at least you're hopefully emptying the tank so you can get a better sleep. If you're one of those that gets stretch marks, thankfully I did not deal with stretch marks. I dealt with many other things besides that, but not stretch marks. Sometimes the cocoa butter works. You can talk to your physician also if they have any recommendations. Sometimes they have free samples. You never know. I don't know about you, but like me, I like free stuff. And then, of course, heartburn. If you're continuing to get heartburn, some doctors might recommend Tums along with a few other things. Just make sure that before you start any medications that you do talk to your doctor about them, just because everybody's different, everybody's story is different. And of course, whatever you might start, your doctor might have a better alternative or know more things about pregnancy, because just because something is good before you're pregnant or after you have your baby does not mean that it will be safe during your pregnancy. And of course, during your whole pregnancy, you really want to make sure that your baby is safe and protected. The next topic that we're going to talk about are milestones. Just a few milestones for your baby. At 4 weeks, your baby is officially called an embryo, which is fantastic. At 5 weeks, they have a heartbeat. You can start feeling them usually. By 15, 16 weeks, sometimes a little bit earlier than that, depending on if it's your first baby or your second baby. Usually with your second baby, you feel them a lot sooner. Around 10 weeks, you have your major organs, your kidneys, intestines, brain, liver, and then of course around 16 weeks you can know the baby's gender. Between 16 and 20 weeks they start doing anatomy ultrasounds. Usually around 20 is the point where most doctors will schedule your anatomy ultrasound. They'll find out if you're having a boy or a girl. And then at 37 weeks your baby is officially term, which is fantastic. And then at 39 weeks they're fully term. So 37 is early term and 39 weeks is fully term, and then they're ready for birth then, of course. So that's always fantastic. And then our next topic actually is our prenatal visit schedule. So now that we have talked about things to think about in pregnancy and where you're going and the different trimesters and what to expect, we talked about all the different things that will be developing in your baby. Now let's focus a little bit about your visit schedules with your physician. So your OB will probably see you as soon as possible. Usually between 6 to 8 weeks they start doing a prenatal ultrasound and then some prenatal lab work as well. The lab work will come with rubella, HIV, hepatitis. Also, they might do the ultrasound as well. The ultrasound is important because the earlier they can date the ultrasound, the more precise they think that estimated due date is. So if you have an early ultrasound, they're gonna be more confident in that date of your due date, because of course sometimes it could be earlier, sometimes it could be later. So it's really important. Around 11 to 18 weeks, you're going to be getting your nuchal translucency, which is basically, it's going to test for some genetic abnormalities of your baby. They might do a quad screen, which is basically a blood test as well, just to kind of see if your babies are at risk for any genetic abnormalities. Around 18 to 20 weeks is when, like I was mentioning before, they do your fetal ultrasound, where they test your gender and they test the anatomy, make sure that there's no problems with the heart and the kidneys and all that good stuff. They might see a little spot in the heart or the kidneys, which is usually not that big of a deal. If they see a spot, they might have a cardiologist come if it's a spot in the heart. Just to kind of make sure that everything's okay with your baby. They might do an echo once your baby is born, an echocardiogram or an EKG, just to make sure, because sometimes those spots can mean that the baby has something called a patent foraminal valley or another hole that didn't quite close up, because the plumbing in a baby is completely different than a plumbing in a baby that's inside. So on the outside and the inside, it's completely different. So you'll start seeing that. Around 24 to 28 weeks, you'll start seeing a glucose screen to test for gestational diabetes, which is very important. If you had gestational diabetes with one baby, that does not necessarily mean that you will have gestational diabetes with another baby. But if you do have gestational diabetes, it's very important to follow the recommendations of your doctor. Just because uncontrolled sugar is basically, it's very, very harmful to you, and it's very harmful to your baby. And then once you start getting around 28 to 36 weeks, you'll start seeing your doctor every other week, rather than some doctors do it once a month, but you'll start seeing them every other week. And then around 36 to 40, you'll start seeing them every week. And then 40 week plus, you'll start seeing them probably around twice a week. So there's just some important visits for your baby. As for prenatal complications, I was talking about gestational diabetes, which is very important, but another one that I definitely want to talk about is preeclampsia. Preeclampsia is important to understand because that's high blood pressure, and high blood pressure is a silent killer. So sometimes you might not know that you have high blood pressure until your symptoms arise, but once your symptoms arise, it's usually very, very late. Symptoms include you have headaches, blurred vision, dizziness. You'll start seeing those. If your doctor prescribes you blood pressure medications, it's very, very important to do as much as possible to check your blood pressure at home. You don't want to just leave it unnoticed if you have high blood pressure. So I usually recommend checking your blood pressure before you take your blood pressure pills, and then at least a few more times throughout the day, depending on how often you have to take your medication. So I hope you enjoyed this class. We first started out with just a few things to expect in your pregnancy, first, second, and third trimester. We then went on to the baby and what to expect on the baby's development, and then we followed up with your physician visits, and then we finalized with just a few prenatal complications. During your pregnancy, a few things that you would want to look out for, and definitely contact your doctor if you have any of these. If you have signs of a UTI, if UTI is basically any burning, stinging, if you have any fever, you definitely want to talk to your doctor about, and burning and stinging and urination, of course, just to be specific. And then of course, if you have any vaginal bleeding or uncontrolled cramping, those are all reasons to see your doctor as well. So I hope that you enjoyed this series, and make sure to watch my second video, which will be going over labor and delivery. We're going to talk about a lot of really nice things. Don't forget to subscribe to my channel and follow me also mommydidyouknow.com, where I have all of the lessons actually online, so you can read through them as well. I don't know about you, but for me, I need a combination of things. I'm not only visual, I have to do stuff, I have to read, I have to watch. So this is very good, and I hope that this combination is going to help you.